Colleen, or what?
Colleen's
Yeah,
here.
Colleen's here.
Sounds like his footsteps. Good morning.
Okay, it is 9:02. We're gonna go ahead and get started. We might have a few people popping in, but the Open Meetings Act, a copy of it is located on the wall over here at the entrance of the room. We can go around and start in the room of who's here. Maria Borgeson, County Board.
Chris Rogers, County Board.
Kimbolo, County Clerk.
Karen Cole, Commissioners.
Patrick Bloomingdale, County Administrator.
And on the phone, okay, you wanna,
Mark Kraft.
hi Mark,
Colleen Fredrickson, HR.
hi Colleen,
Diane Carlson. Diane Carlson.
hi Diane,
Aye.
Andrea Hall from Lockton.
Audrey,
Lisa Beesing with Lockton. Kim Gidley with Blue Cross Blue Shield, Nebraska. Morning, Carol.
Can you repeat that?
It was Kim Gidley with Blue Cross Blue Shield.
Oh, and Karen Bush.
oh, okay, I saw Karen popped up.
Hi, Dan Edge, Douglas County Clerk.
I thought we had Marcos, right?
Well, we have Marcos and Catherine Hall from our office. And, yeah, I don't know who they
There's Catherine, Colleen Fredrickson and Karen Butch from Human Resources.
Yep. Okay, well, we have 2 items today on the agenda, and the first one is the potential Blue Cross Blue Shield Administrative Services Agreement Addendum. The Blue Cross people, do you want to go ahead and start and explain what you're offering? Kim, I think, is going to be the one leading here.
Yes, thank you. Can you hear me all right?
Yep.
Okay, wonderful. Well, good morning, and thank you for allowing us to be on the calendar this morning. We did want to thank you for your business and valued partnership. And with everything going on in this day with COVID-19, we understand the extra burden that is put on our business partners, especially the county, with regulations coming down on a daily basis and messaging that needs to go out to our public and taking care of our county employees. So with that, we know that the county was due to go to market this year, and with that in mind of the current pandemic and really the burden on the resources that we have already, we know that creates a lot of extra work for the county, for Lockton. And so with that in mind, we wanted to offer an extension through 2021. And basically, we would just keep our fees, our administration, as well as our current benefits and provisions in place for another year. And that really is to be able to lighten the load for the county. So it's one thing that isn't on your plate to deal with, as well as the pandemic and everything that's going on with that. So we did offer, we sent over an offer to Lawson for their review. And again, this really is just extending the current agreement that we have that goes through December 31st of 2020 for another year into 2021. It would expire at the end of December 2021, and of course, we would expect to certainly work with you and Lawson on the upcoming years and putting something together to keep our partnership going.
Okay.
Any questions at this point?
Are there any questions for Kim? And if you, I think it's *6 to unmute your phone for those that are muted if you need to ask a question. Lisa Deasing from Lockton, did you have anything to add?
Thanks, Marianne. I just want to jump in, and Kim, thanks for joining the call today and explaining the opportunity for extension. If you could also touch on, because as we know, another important piece of this contracting relationship with Blue Cross is the stop-loss piece. So if you could help us understand kind of where we are with evaluating that, and how we will look at continuing that into the next year through this extension as well.
Yes, absolutely. Thanks for bringing that up, Lisa. So the stop loss is also part of the agreement that we have with Douglas County. Typically, we will send out a preliminary renewal towards late summer, early fall. In light of the extension on the administrative piece, we have also asked our internal partners to provide an early quote for the stop loss, and we are currently working on that, and we should have some numbers for Lawson to pass along by mid-next week. So we are working on that piece so that we can extend that as well as our other portion of the agreement. Lisa, anything else that you would like me to add?
Thanks, Kim. No, at this point, I think that sounds great. And to the county, certainly we will keep you updated once we have that proposal from Blue Cross.
Thank you.
Wonderful, thank you.
Karen or Colleen, do you have anything to add?
So, this is Karen. So, Kim, if this goes into effect, would this be retroactive? I mean, it's obviously for the rest of this year, but would there be any consideration to lowering the rate? And the reason I ask is that the county is experiencing obviously some financial expenditures due to the Families First Corona Response Act, where we're going to have to be paying employees basically for the expanded FMLA. And unfortunately, unlike the private sector employers, we are unable to take advantage of the payroll tax credit. It's not been extended to public agencies or employers. And so we were wondering I'm wondering whether or not Blue Cross Blue Shield would be willing to actually decrease the administrative fee per employee per month, if that would ever be something that Blue Cross would consider.
Karen, thanks for the comment and the additional information behind that. Certainly we would want to partner with you, and unfortunately I'm not the decision maker on this one, but I would be more than happy to take that back to our team and see what we have available. Just as a follow-up question, are you looking for 2021 or are you looking for something more immediate?
Well, we obviously we would be open to 2021, but I think from my perspective right now, our need will be immediate. This law went into effect yesterday, and we've of course had to expend additional funds just because of the nature of just because of the nature of the entities we have, for example, the health center, the community mental health center, they're like hospitals, in that we have a greater expense for PPE to keep our employees and our patients and residents safe. And we have the same issues at our jail and our youth detainee center. So, and we've been having to gear up for this for some time. So I think we would be looking at something more immediate.
Okay.
Sure.
Yes, I'm more than happy to get that conversation back to our team. And I will do that as soon as possible and get something over to Lawson to share with you. So we will make that a priority.
That would be wonderful, and we very much thank you for taking that back to the team for discussion. It would really be helpful.
Absolutely, it's my pleasure.
Thank you, Kim, for that consideration. Anyone else have anything to add or questions or comments? Patrick?
Well, I mean, we'll have to talk about it. Come in, camera. Okay. I have a face for radio. So. I think that we need to obviously talk about it among the commissioners as far as whether we want to. I mean, I have my opinions. I don't know if you want me to express them now or later. But if you want to, I think we should definitely extend it for a year because I don't feel comfortable, given everything that's going on, that we're in a position to go out for an RFP right now. So I just think it makes sense to accept that invitation from Blue Cross and extend the contract for a year.
Well, Karen's mind was kind of where my mind was going in terms of asking if there is any possibility for a reduction because of what we're experiencing. So I think once we hear that hear back from Lockton on that, I think we can have further discussions with the commissioners. Anybody else?
Yeah, I would definitely be in favor of that for a multitude of reasons, but definitely the ones that I agree with Marianne and also with Patrick. It would be somewhat, I mean, we could do it, but it would be more difficult to do the RFP, but we could definitely do it if we had to.
Okay. Well, we'll wait to hear back from Lockton and then move forward from there. But again, I want to thank Blue Cross and Blue Shield for the offer that you have set forth and look forward to further discussions with you.
Wonderful. Thank you so much for letting us join the meeting today.
Thank you.
Thank you, Kim.
You're welcome.
We do have one more item on our agenda, and that is the Family First Coronavirus Response Act update. Karen?
Yeah, so things are moving along fairly well. The Civil Service Commission did adopt the revised infectious disease rule, and then also, excuse me, also adopted a new rule that would bring us into compliance with the Family First Corona Response Act. The act, through the adoption of this, we have excluded from the benefits that are extended to employees, we have excluded a number of departments that would be considered emergency responder or healthcare providers. So all of the employees at the health center, all the employees at the community mental health center, the GA public, the health clinic, the health department, corrections, the youth center, and 911, their employees will not be able to take advantage in general of the relief provided from this act. And partially that was done, primarily that was done in order to ensure that we would have sufficient staffing in those areas where we're responsible for the life and well-being of our citizens and other individuals that may be within those facilities. We also have amended our FMLA forms. There is continuing guidance that's being issued by the Department of Labor, and they have issued some temporary regulations as of yesterday. I do think this will continue to evolve, and it may require that we may have to modify these policies. We have to be in compliance. There was some relief for 30 days from the day the bill was passed, so that relief will last until April 17th for us to become compliant with the law and any accompanying regulations. We're asking, or will be asking the board to take action on both of these civil service rules this coming Tuesday, so that they would apply to anybody that is not civil service but would be under the authority of the county board. We are beginning to get called, and we are seeing individuals seeking to take advantage of these benefits for the employees that are eligible. And I anticipate that there will be an increase in number of employees that will be absent from work. Primarily what we've been hearing from so far are employees that are in the high-risk category, that already have FMLA, that or they have family members that have FMLA, and their healthcare providers are amending their medical certification stating that they need to remain home in order to not have any further difficulties associated with their health condition. And then we are seeing employees that are stepping forward and asking a lot of questions about the use of the emergency paid sick leave and the emergency expanded FMLA as it relates to staying home because they have children. There have been some questions raised about the intermittent use, especially of the emergency paid sick leave. And we don't have any issue with the emergency paid sick leave out of our office being used intermittently. The Civil Service Commission does not either. We have individuals, say, for example, who their wife or husband can work Monday, Wednesday, and Friday, which means they need to stay home on Monday, Wednesday, and Friday, but then their spouse will stay home on Tuesday and Thursday, so they will be coming into work on Tuesday and Thursday. So this is consistent, I believe, with the way our rule is written, that it would only be utilized when it's needed. So I believe that would probably address most of the update items.
Anyone have any questions for Karen on this?
Yes, I do. This is Mark Kraft.
Okay.
We have other essential departments such as the payroll, such as the register of deeds. I'm trying to remember the death certificates and things such as that.
Part of the health department. Those departments are already, in some cases, have employees that are alternating their work shift because of social distancing. So I think for the most part, those departments are able to handle, and they've implemented ways, is my understanding, and I think Dan Ash could also address this for his department. But I think most of the departments of that nature are addressing a lot of the work through electronic means, where employees can either call in or they're able to email or fax, and then responses are provided. My understanding is that the Assessor Register of Deeds office has already restricted public contact to their office, as has the Treasurer's office, and they're able to operate and still provide services through alternate uses available through varying technologies.
My concern has to do more with are employees getting sick and not being able to utilize, the people working the payroll, getting sick, the people who have the expertise, you know. not being-
Sorry, I misunderstood, Commissioner Kraft. Thank you for clarifying. Those departments are not considered healthcare responders or healthcare providers or emergency responders. So those departments are able to take advantage and have taken advantage or will be taking advantage of the benefits. I think most departments have backup coverage to be able to cover payroll functions and other types of functions that are critical. And Dan, if you would like to address specifically the payroll, that would be great.
This is Bill Kavanaugh.
Dan, did you want to add anything?
Sure. Yeah, Dan Esch. Just as far as there was an issue with the department not being able to enter payroll, we just kind of have a system set. I mean, first of all, we would communicate with the department head or whoever else that department needs to be spoken to. But if there was an issue where they literally could not enter in payroll, we would just set it up to where whatever those employees would have received for 40 hours, that's what they're going to get paid. And if we need to make adjustments to the next payroll, whether they got overpaid or underpaid, we would make those adjustments then.
Okay, thank you.
Karen, on the essential departments that you listed up, I just want to make sure I have them all. The Douglas County Health Center, Community Mental Health Center, is it GA and the GA clinic or just the GA primary health care clinic?
That would just be the primary health clinic.
Okay, and the health department, corrections, DCYC, and 911, correct?
Sure.
Correct.
And the sheriff?
Oh, of course, the sheriff's office, yes. Sorry, thank you for mentioning
Thanks,
that.
Patrick. Okay. Any other questions on the update? Karen, we are still waiting for the Department of Labor guidelines, but yet we have to be ready to go live or be ready to implement this, hang the posters, whatever, April 17th.
Well, the law actually went into effect on April 1st, so we have the posters and things necessary been distributed to the departments for posting. We've posted it on our website. We've also sent out an email to all the employees on the rules, informing them that it's effective April 1. We have until the 17th in order to figure out how we're going to implement and keep track of the 10 days for emergency paid sick leave and those types of things. And if we need to delay until the 17th to allow employees to take advantage, we can, but then the benefits would be retroactive to April 1. And yes, you are correct. The Department of Labor has issued temporary regulations, but they have indicated that those could be modified. And they have issued FAQs, which we use to create our rule for civil service. They have issued those over several days, starting in, I believe, March 25th was the first date. The last change was March 28th. There's about 59 FAQs that are out on their website, and we utilize that to help us create our rule, as well as the actual act that was signed by President Trump. But there could be changes in the federal guidelines. It's possible that they could actually contradict anything that's in those FAQs. It's unlikely, but it could happen.
Okay. All right, that's helpful. Thank you. Any other questions? Jim?
Karen? Jim Kavanaugh. Karen, I was wondering if the information that you sent, just outlined, and thank you for that, could be sent to us electronically. I don't see it in the attachments that we got from Karen Cole on this meeting.
Oh, absolutely, Commissioner. We sent an email out to all county users email group, but if you did not receive that, I'll be happy to forward that to you directly. And so that
Thank you. Thank you. I'm sure it's in there someplace, but I'd appreciate it. Thank you.
You're very welcome.
Okay, any other questions or comments? All right, if there's no other questions or comments, those were the two items for our agenda. And we will be back and update you once we have additional information. With that, the meeting is adjourned.
Thank you.
Thank you.